Our next speaker is Dr. Dee Griffin. Is very much like Mike and others speaking at this meeting. He really doesn't need an introduction, but Dee grew up on a cow-calf operation in Oklahoma, went to, obviously, Oklahoma State, and after he finished his DVM there, he did graduate work at Purdue University with emphasis on pathology and nutrition. He was a staff veterinarian for Hitch Enterprises for a number of years, and while he was there, I had the privilege of meeting and working with Dee as I'm in the diagnostic lab there in Amarillo. Learned a lot about Dee and gained a lot of confidence in him. Today, he is a professor at the University of Nebraska. Specifically, he teaches the Great Plains Veterinary at the Great Plains Veterinary Education Center. He's working with numerous beef herds and feedlots across Nebraska, especially in the area of developing biosecurity and pre-harvest HACCP. Dee is a former president of the Academy of Veterinary Consultants. He has received numerous awards. I think most of us know Dee as a source of information, and I'm convinced if he doesn't have it on the tip of his tongue, I think we all know he can find it with the tip of his fingers. Thank you, Dee.
Do I have this turned on loud enough and in the right location, roughly? If you can't hear, you're the lucky one. I will start by understanding that we're largely a group of veterinarians, and BRD is not our problem. Come on, do it. Thank you. At least in my world, I tell the students, if you can't blame it on a nutritionist, you're not trying. So I have the diagnosis of BRD, and you're looking at it, and we can all go home. At any rate, I'm going to run through. I've got about 104 slides here for 20 minutes, and so I'm not going to spend much time on any particular slide. You understand all these kinds of things. I'm going to visit with you some about these issues down here, the cost that we don't see out front. It's easy enough to count up the deads and look at how much we spend for vaccine and so forth. The deal, and I'd be about the fourth one to say it today, immune preparation is a critical key. Treatment timing, Dr. Apley just mentioned, is a really important key. And understanding that cattle that have high temperatures don't necessarily mean they're sick. One of my starts in life was at Purdue University, in which we experimentally infected animals with IBR, and we implanted these little devices in them that would give us their TPR as we walked by them. We could record that. I was the blind control pen walker because I thought I knew how to find a sick calf. And I was pretty impressed that after about 72 hours you had of exposure to IBR, experimentally a virulent virus, by the way, produced by Dr. Mock, who come from Amarillo, was the virologist at the time in that study. 72 hours, there wasn't anything in the pen that had less than 105. And most of those were at 107. And this was in the wintertime when it wasn't hot temperatures, and everybody in the world now has black cattle, which puts another wild card. I'm not sure. My personal preference is that we start a certified white Angus program, at least to feed in July, August, and early September. And we understand that this is the deal. The first time they get an injection of an antigen, they have a response, and it's not until they see that antigen after a period of time for their immune system to mature, for them to respond with an anamnestic response. That's a critical key. Stress management, which Dr. Knopfsinger is one of all of our heroes, not the first one, who has pointed out that these kinds of issues are huge. I have a sign in my office that if you abuse an animal in any fashion, nutritionally, of which all nutritionists do, and nutritionally, environmentally, physically, or emotionally, they will take it out of your pocketbook. I don't know at what level they take it out of your pocketbook. Sometimes they don't take enough out for some of the abuse we cause, but those are critical issues. And we understand how this works. And we have lots of folks that are my age that were brought up with the hot shot mentality, move them fast, how you get it done. And we have a whole generation of veterinarians coming behind me that understand that you walk, don't run. It's that old bull walking down the hill. I understand that now, but I didn't as a young person. Maybe I'm not at any rate. So when you put those together, in our typical scenarios that we have in feedlots, by the time we transport them, we wean them literally on the truck. Transport them, we change their diets. And if that's not enough to make them sick, if we decide to bring blood when we dehorn them, or do it without anesthetic and make them suffer, of which we've been using the anesthetic for decades, I just don't like the fight. 5 cc's of lidocaine is almost instant unless you give it too deep. And the calves don't bawl and drown out Willie Nelson. So it's just a better working environment. And castration, I've always thought, Angus bred the horns off. Maybe if we bred them all to limousines, we'd breed their nuts off. But they would still have an attitude. I'm not sure how that would work. But if we can do these kinds of things out front, we know it works. And transportation is still going to be a stressor. And diet change, of course, we're not going to get rid of nutritionists anytime soon. We all recognize these. Dr. Apley talked about those. But seek and treat is less than useful, I think. When I back in the 80s, I started spending time at the packing house looking at lungs. And I was really curious because we would see groups of cattle that had the standard 15 to 20% pulls. You get the packing house and you might see 50% lung adhesions. And you're going, how did we miss those? Or we have our 15 or 20% pulls and you get the packing house and you see nothing. Well, what were they? Did they just have a bad day missing their mother and somebody says you look sick, so we're going to give you, back in those days, LA-200? And misdiagnosis is huge. This happened to come out of a 5,000 head set out of Missouri, and we've all seen these quinine dying pukes. Right? Chronic pneumonias. Except the abomasum in this animal weighed 27 pounds, and Jimmy Williams was orgasmic when I sent it to him. This was prior to the days that we had ivermectins, and ivermectins helped out on those kinds of things. But misdiagnosis is huge. But pleurisy does hurt. Finding sick cattle early, I think it can be an impossible job. Cattle are prey animals. They got millions of years of genetics built in their system to not look sick. And we ask our cowboys to ride out there. How many cows do our cowboys look after? 5, 6, 7,000? Plus we've got fences to paint, cattle to ship. I don't know. We assign a lot of stuff to them. They lope through these pens and they give every calf a 5-second look. It's an impossible task that we ask them to do. And we do very little to help train them or guide them. It's like, do you know how to ride a horse? And they get to be one. And this old calf sitting out there and he's just looking like crap. I just feel like, oh shit, I can't make it another step. And his buddy says, this cowboy's coming. And they pulled Larry out yesterday and they stuck this 14 gauge needle in his ass. And he goes, oh, okay, I'll walk over here and stand at the bunk and look like I'm eating. He's gone. Oh God, great. I'm glad. My testicles are still stinging from that big rubber band they got around them. I don't know. And on about day 3, he's going, I don't care. Well, you pulled him too late. And they're tough. Thermometers, Dr. Apley very well aptly pointed out that thermometers lie to you. You can't trust a thermometer. A black calf on 2 o'clock in the afternoon in July is 107, probably because he's been standing out back for a while. Or he's a kind of cranked up calf. Depression has been the key. We talk about DART, D-A-R-T, and depression is the first of those key. So if a calf's up here, we think he's better, and maybe not down here. We looked at pulls versus, this is some old hitch data I had. We looked at pulls versus not pulls, and its effect on gain, pretty obvious. If you look at the data from, well, I'm going to go on. We started looking at how can you score lungs at a packing house. Active infections are a really bad deal. If they've got walk in the packing house with an active infection, you're going to drop a pound average daily gain on those cattle. If they've got pleuritis where their lung is stuck and it hurts when they breathe, you can just walk off somewhere between but approximately a third of a pound average daily gain. If you've got a significant, I don't mean the point that their lungs pull loose, just a significant adhesion. And we look at them in the coolers all the time. If they've got a stuck lung, they frequently will strip out the pleura, and you can walk through a cooler and figure out. And if it's a stripped pleura that still has the diaphragm intact, it's probably a pneumonia, not the holdover from a liver abscess. Granular lesions, we like to call those atelectic lungs, but pathologist says we can't do that. You can see, I think you can see, and histologically, I am fed my ego because under the scope you can find out that you're right. Previous lungs that heal pretty normally will have a slight depressed gray color. And then you see parasitic lesions like this eosinophilic stuff from migration. But this is this is a gamut. This is a very angry lymph node, as Dr. Pansier used to say. That's really pissed off. I've got an adhesion. I've got adhesion so bad that it leaves part of the lung. I've got these granular lesions. By the way, this is that adhesion associated with the liver abscess, so not all severe adhesions are associated with BRD. And then you've got this bronchioectasis in which you've got pretty significant proliferation. Lung scoring. This is the sheet that we use. You can download this stuff at our website. But on a pretty rapid basis, it's kind of like doing an 8 to 12 second necropsy. They're moving the chains are moving in the neighborhood of 360 to 400 an hour. And you've got pathologists, or inspectors rather, who know what they're looking at, and unless you've been a bad person, they will help you find them. You know? Now, if you've been a bad citizen in the packing house, your life's not going to be very good. So bring the jerky and donuts and do what you're supposed to do. At any rate, I guess that didn't sound very good. But you can check these off pretty rapidly. This is some numbers that happened at our place when Dr. Marilyn Corbin, who used to be Buman, was at our place. If you've got really bad lung lesions, you've got really bad loss of performance. And these were lesions that would be active or severe adhesions. And we're not the only ones. We were maybe the first ones to do it, but if you look at references that take any number of different operations, Dr. Bryant did his master's study or program at our place. You see a pretty consistent loss of average daily gain and an effect on carcasses. We put that system in a modern packing house, computerized it, and it looks something like this. So you sit there, and as you look at it, you literally punch the button for each one of the things that you have. That's what it looks like up close. But these are the lung scores, and then I'll not go through the kidneys or pregnancies or something. And these were the defects we were looking for, 0 through. And not defects necessarily, just get them in the right category. Well, here you go. So as they're passing by, you've got lesions that you have condemned lungs, purple from minor purple lesions in the lungs that we're asking folks to look at. Major purple lesions, which are in fact the collapsed consolidated granular lesions I was referring to the minor adhesions. And those don't look like much, but in Dr. Bryant's work, they were almost 1/10 of a pound average daily gain. And his cattle came from not just the Meat Animal Research Center, but commercial feed yards as well. If you look at major adhesions, now this doesn't look horrible, but these are 1/3 of a pound, guys. If you've got really bad ones, you're talking about up next to half to a pound of average daily gain loss. And when you look at stuff in which all you have left when they pull the pluck is the trachea with a little bit of lung tissue around it, those calves, if you look at the hot carcass weights, they're a good 100 pounds behind everybody else. Really severe ones. This is not a very severe lung adhesion, but it does represent what that looks like. And then you've got odd things. I mean, this is a healed parasitic lesion, but when you look at those under a histopath, they don't mean much. Active lesions are frequently identified because they'll see this in the lymph node and condemn it. But you can't always count on that. So just looking at a condemned lung in a packing house doesn't mean much. So, if you look at the numbers, BRD costs. It costs in average daily gain. It costs in feed efficiency. It costs in carcass value. I've done a spreadsheet. I'm kind of getting us back on time, I think. I've done a spreadsheet in which I looked at sickness rates of 18, 16, and 15%. And I did that because that's a 2% difference and a 1% difference. I bought these cattle a couple of days ago. They come out of Missouri. I didn't personally buy them. I went to the reporting service at ams.usda.gov, and that's Agricultural Marketing Service. I fed them to the 14 pounds. These were 5 weight, actually 525. I don't know why I didn't type that in right. And I bought them for $250, which is like a pipe dream. But I could wish, right? I had to do it to make the break-evens work. I processed them for $30, and in that $30 bill, I've got a $12 metaphylaxis or whatever that, right? I don't know who came up with that term. The FDA doesn't understand what that term is. But nevertheless, they've got some drugs in them. I got I tell you what that was, and I spent $20 a head treating them, which is maybe also a pipe dream. But nevertheless, that's what I did, and I did the same thing on the relapse costs. Now, I skipped a whole bunch of stuff in here and went to their production cost at $150 equity, which I'm hoping for, maybe not. This group loses me a little bit of money, but it's basically a break-even. Going from here to here is a difference in return on equity of about 7%, which is as good of investment you're going to get. 1% of that, and I was very, very conservative in my estimates. Dr. Engler mentioned earlier that they're talking a $20 bill on the 1%. I was wanting to make sure nobody accused me of overestimating the effect. If you look at just the lungs, and this backs into the data some, and look at the average daily gain loss across all lesions of affected cattle at 0.07 pounds average daily gain. That's the minimal number that's been reported in the literature. Percent of cattle with affected lungs, I gave them the following numbers. Average daily gain across severe lesions, I gave it at 0.3, and that number reports at about 0.33. Percent of cattle affected with severe lungs, I've got these down at 5%, i.e. Not much. 30%, we see those all the time. But nevertheless, I put all the rest of the numbers the same. I put a choice select spread of $5. So the difference between a choice carcass and a select carcass, you understand there's 1,000 marbling points in the grading system, right? On an A-maturity carcass, which means one that's less than 36 months of age, which is classified based on the ossification of the dorsal spinous process as it moves from their sacrum toward their head. And when it reaches the thoracolumbar junction, you're moving from an A to a B maturity. A maturity carcasses, you got to get 300 marbling points to be a select carcass. You got to get 400 marbling points to be a choice, 500 marbling points to be a premium choice or high choice or certified Angus beef, 700 to be prime. When you cross the line into B maturity, you have to have 100 marbling points to make the same grade. There is no select grade in B maturity, so those are all standard, which is about a standard $20 to $25 discount, 100 weight. So bee maturities suck. But nevertheless, we don't see a lot of those. But what I've got is a $5 discount going from 300 to 400 marbling points. If I bottom line that, every animal in the group, just associated with the loss of value of carcass in this scenario, everybody took almost a $9 hit. That's not medicine. That's not loss average daily gain. That's just loss of carcass merit. So these are expensive numbers. And if you back up and look at that $9 effect on how it affects your return on equity, cattle feeding is an equity business. I need $2,000 to run a calf through the system, and the banker wants me to have $200 before he'll loan me the other $1,800. Owning a feedlot is an asset business. Owning cattle in a feedlot is an equity-based business. So making $20 on a $2,000 deal can be pretty good, provided you got the banker's money in this deal and you don't lose your tuchus. At any rate, so the bottom line, and I'll shut up here, lungs are either stuck plugs or they're real angry. It seems, the numbers that I pick up, that we have between 20 and 70% have some damage in the lung areas at the packing house. 25% up to that can be severe, in which you're picking a third of a pound or better average daily gain loss. The cost can be from 0.0, or actually I put the minimum in at 0.07 up to a pound. But there's good numbers, not just in this country. Thompson out of South Africa published a number that looked like a 1.25 effect on average daily gain and a half a marbling score, which is, in my case, a $5 bill. A $5 bill on a 9-weight carcass is $45. That's what it cost. Time.